what happens if a person that's supposed to go to the urgent care goes to the emergency room?
Kids are naturally curious.
But it helps us learn. I'm Lizzie.
I am Tammy Barnes, and I'm a registered nurse here at Trios Health. Today we're going to be discussing the differences between going to an emergency room and an urgent care. So today we're here to discuss the differences between emergency departments and urgent cares, and when you should go to the urgent care versus the emergency room.
Well, what's the difference?
Well, the emergency room is where we would take those more critical patients that you need to see a provider right there in that time frame. Where an urgent care is where you can go for more minor things, such as a cold, sinus infection, a cut finger, things like that.
So what happens if a person that's supposed to go to the urgent care goes to the emergency room?
Good question. So if the urgent care gets a patient that should have gone to the emergency room, such as a patient that comes in with chest pain and they're having a heart attack or something like that, we would immediately call 911, have the ambulance come over. Our doctor would call the doctor at the emergency room, and they would have that patient transported to an emergency room with all the facilities that they needed. If a patient goes to the emergency room that should have gone to the urgent care, unfortunately that patient will be seen in the emergency room, which actually ties up the doctors from seeing those urgent patients that they should be seeing, and actually will cost that patient a whole lot more money than if they'd gone to the appropriate facility. So give me some examples of things you think should go to the urgent care or the emergency room.
Urgent care, maybe a broken finger, a broken nose, a cold, cough.
And what about the emergency room?
Well, the emergency room, you would go for like chest pains.
Absolutely.
And breathing problems. You can't breathe right. You would go if you had a really high fever, I suppose.
Well, depending actually for a high fever. Kids run fevers much more than adults do. So if an adult has a really high fever, 105 or something like that, there's usually some kind of infection going on, and we recommend they go to the emergency room. Where a child frequently will run 102, 103 at the drop of a hat, they got a simple cold. But then there's things like the flu that we see every fall and winter, that if you have the flu and other symptoms that go along with that, such as a cough and a fever, sore throat, that's actually very normal, and we actually treat that in the urgent care as well.
What is the serious thing you've seen in the emergency room?
The most serious thing I've seen in the emergency room?
Yes.
We actually get trauma victims, so patients that have been in car crashes, severe accidents and things like that is what we'll treat in the emergency room. You would never want to take somebody who's been in a car accident or something like that to the urgent care. The urgent care just does not have the facilities to scan and to x-ray, do CAT scans, MRIs, things like that, like the emergency department does. So what do you think the cost difference is in an emergency room versus an urgent care?
Well, urgent care is a lot slower, so I suppose it would be cheaper, because the emergency room, doctors are racing everywhere trying to get to patients as fast as they can, and they do a lot more than urgent care does.
Well, in the urgent care, we can get very fast-paced there as well. So we can see 50, 60 patients a day if we have a couple providers on site, but the urgent care is considerably less expensive than if you go to the emergency room, which is going to have a lot more equipment and supplies and things that needed to take care of those urgent patients.
Does the urgent care have the same hours as the emergency room?
Good question. No, we do not. An emergency room is 24 hours a day, 7 days a week, where urgent care is frequently only open till 8 o'clock at night, and that's Monday through Saturday, and Sunday for some urgent cares, and other urgent cares actually close down on Sunday as well. So if it's in the middle of the night, you're obviously going to have to go to an emergency room versus an urgent care. One of the things I wanted to make sure that you're aware of is that urgent cares are frequently used as a primary care provider. Instead of a patient actually reaching out to their primary care provider, they'll just come into the urgent care. What most people should do if they have a cold or a sore throat, earache or something like that, is they should get a hold of their primary care provider, see if they can get into their office first, and then if they're not able to come into the urgent care. Another time that it's very appropriate to come to the urgent care is after hours. Most doctors' offices close by 4:30, 5 o'clock, and then the urgent cares are open till 8, so you definitely have that option available as well.
So if I go into the emergency room, will I get to see the doctor faster rather than urgent care?
Not necessarily. It's going to completely depend on how many patients are ahead of you and the acuity, the severity, how sick they are. So if you've got an ambulance coming in who has got that patient with, having a heart attack or a stroke or something like that, and you've got a simple cold and you're waiting in the waiting room, you're definitely going to wait. But if you go to an urgent care, it's the same kind of thing. So we'll see you by first come, first serve, unless we have some in that are bleeding, have a broken bone, and need to be seen before you. So, it's always a toss-up on where you're going to be seen, quicker. You can go to either an urgent care or an emergency room and get seen right away, or it may take you hours. So just kind of a recap of some of those important differences between an urgent care and emergency room. For an emergency room, you always want to go there first if you have any kind of chest pain, difficulties breathing, you think you are having a stroke, something like that. Children with severe abdominal pain, even adults with abdominal pain, if it might be appendicitis or something, should also go to the emergency room. An urgent care should be more for your basic things. You've got a cold, a sinus infection, earache, sore throat, things like that. Anytime that you question any kind of injury, illness though, and you're not sure and you believe that your immediate health is in danger, always call 911 or have somebody take you to the emergency department. So thank you for meeting with me today, Lizzie. But I just wanted to make sure that, anybody who's watching or has any questions, that they definitely go where it's appropriate. If it's not something that's immediately urgent, make sure you contact your primary care provider. If you need to be seen, go to the emergency room or the urgent care. But remember, the emergency room is for those critical patients that can be life or death or have a severe injury or something, where the urgent care is more for our everyday type of common problems. And make sure that you're choosing the one that's appropriate for that.
Thank you for meeting with me.
Thank you.